Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Life expectancy gap is getting better. And what is so especially rewarding is to see that in Black individuals, this is the case as well, because for many years that was not the case. However, that's not true for the American Indians or Alaskan Natives. And it reminds us of the debt we owe to the Native Americans whose country we live in. But we still need to work on increasing the life expectancy of the Alaskan Natives and the Native Americans. But the good news is that the life expectancy has risen between 2000 and 2019, especially from 2010 to 2019. I think it's interesting as we go into a new administration, which may not be as friendly to minority populations. It's going to be interesting to see how that affects the life expectancy as well. Maybe it'll get even better. Who knows? But it's nice to see some good news for a change. We know that the life expectancy in the United States is not as good as some other countries, but it's still the fact that it's getting better is good news. This is a laundry list of the Latinos and other areas in which life expectancy increased. Of course, more recent studies have suggested that that has happened, but in the future, we don't do better. We will be way down on the list of other countries because they are living much longer than we are. Yeah. As you see here, the three Black Americans had some of the largest gains in life expectancy, increasing by as much as 3.7 years. Yeah. So it's good to see that things are changing for the better for African Americans. Will this be sustained with the new administration? Time will tell. It's kind of hard to estimate the impact of discrimination and racism on health, but we know it doesn't. We know it deteriorates health. The extent to which it deteriorates health, we aren't absolutely sure. In other words, how many years of life does it take off from you being Black and being in a country where your race is an issue, or your ethnicity, I should say, since we're all Homo sapiens. Any comments on this change for the better? Sharing good news is worthwhile. So, any comments or questions?
My question is, I wonder how the mass killings are affecting his life expectancy.
Well, probably very little. You don't have that many. When you say mass killings, you're talking about killings where you have 50 to 100 people killed. Is that what you're talking about?
Yeah, we had some recently. We also had somebody take a pot shot at President Trump, too.
Yeah, so those probably are relatively minuscule when you look at the large scale scheme of things.
Yeah, I think the
because
greater impact would just be on gun violence in the United States.
yeah, yeah, yeah. Because we have more of that than any other country in the world by far. Okay, if there are
But
no other
I,
questions,
but
yes.
I think the issue of the impact of discrimination um, on life expectancy. I know it was an old campaign of ABC, the Association of Black Cardiologists. And the campaign was to emphasize that because of health disparities, because of racism in healthcare, it was less than 50% of Black high school graduates had more than two living grandparents. And so when you think about that, you said, okay, two grandparents, they had two grandparents. But when you think about your grandparents, I know when I think about my dad, he thought that I was the sun, the moon, and all of the stars. As a child, having four living grandparents, when you look at that from that perspective, four people who are pumping you up on a daily basis, you see that the absence of those two grandparents impact for generations.
Okay, any other comments on this article? I see Darryl. Darryl.
Yeah, addressing John's question about impact of gun violence, and most of violence affects men in the United States. It says in 2020, mortality due to drugs and firearms combined reduced male life expectancy to 67 years. Without the effect of those two causes, male life expectancy would have been 78 years. That's an 11-year gap for drugs and firearms.
Thank you for sharing. Thank you for sharing. Okay, let's go to the next one. Um, this is an article that's important because it emphasizes the new COVID-19 vaccine as well as the pneumococcal vaccines, which have been updated considerably. And this emphasizes the importance of getting uh, that COVID-19 shot that you need to get. And apparently, it seems as though we're going to need to be doing that every year, at least. Uh, and then the pneumococcal vaccine, of course, has got more antibacterial effect than ever before. And so uh, you can see that those who have the old vaccine, uh, uh, that didn't cover as many of the pneumococcal variants as this one. This has 21 valent vaccine. And so it is compared with the 13 valent vaccine, uh, which is certainly a good one, but it's just that this is better. And so for people over 65, they are strongly recommending the 21 PCV 21. So for those who, I think almost everyone on this call has gotten the COVID vaccine. I don't know how many have the pneumococcal vaccine, the old or the new. But anyway, the CDC has recommended that you get both of them. Any comment, Janice?
Yes, it's now suggested that we get the COVID vaccine, and you said it looks like it might be an annual vaccine. With the flu shot, it's suggested that we get it in the fall. Is there a particular time for the COVID vaccine if it's
Same
annual?
time, same time, fall.
Okay.
Yeah.
And the RSV as well?
Yes. Yeah, since the respiratory infection season is in the fall and winter, it's thought that the early fall is the time to do it. Probably around October. No sooner to me, no sooner than October, and no later than December.
Okay.
Dr. Callender, thank you so much for saying that, because when I went to inquire as to the COVID shot, I found out from the nurse that orders the vaccine. She says, you take it in the fall, yes, because they ordered for September, October, and she said when November comes, they run out.
Interesting.
So that, because I went to inquire, they gave me the the regular one, but she says that's what happened. I was saying, I tried to get it, but they said they didn't have it. And then she began, when she explained that, she says, I know because I ordered. And she says, also, we had an increase of senior citizen, of people that turned into that birthday rolled over into senior citizen during that time. And that was an expected group that we didn't expect. And so they ran out. So and I went on my calendar in big bold letters to make sure I take it in September.
Okay. All right. I see John Buchanan and Jochebed.
Yes, I was wondering about the pneumonia vaccine because I had it 2 years ago, and this is a new one, right? So,
Yeah.
And they said I wouldn't have to have it for 2 years. So, go ahead and get it now, or wait till the other one, September, October.
Well, they are recommending that. So you got it 2 years ago?
I think so. Yes.
Yeah. So it's about time. Yeah. So, and it's now January. The season. It's the time when you get the pneumonias. So if you got it 2 years ago, meaning in 2020, 22 or 2023.
Right. 22, I believe.
Yeah. It would seem to be appropriate to get another shot now if you got 2022.
And it's just one shot, right?
Yes.
Okay. Thank you.
Did I say Jacobet was your hand up, or is that just
No, sir, I did not. Good
that's,
morning.
That's just an emblem on the wall that looks like. Yeah. Okay. We'll go to the next one. This is interesting because now they're lowering the age for pneumococcal vaccine. It used to be 65. They're now suggesting the age should be 50. I'm kind of surprised at that because pneumonia had become something that was more involved with the older population, but now they have changed the age to 50 or older. Of course, many of people at 50 had already received the previous vaccine, but they believe that and of course the other thing that they're mentioning is that whether or not the COVID vaccine is something that should be done at 6 months or a year. And there's a lot of discussion about the fact that whether the COVID shot is something that should be done annually or every 6 months. The full decision has not been made. It's just clear that you shouldn't get the COVID vaccine earlier than 3 months after you receive the vaccine or you have been infected. Any comments or questions about the CDC coming out indicating the importance of getting the new pneumococcal vaccine?
Dr. Callender, is this for everyone or not? Because it keeps mentioning the immunocompromised people, like, those on.
Well, the presumption is if you're over 65, you are to some extent immunocompromised.
Okay.
But they do mention that, but I think that they're talking about 50 for everyone, especially if you are immunocompromised. You're on medication that like steroids and those kind of drugs that compromise the immune system further, then you have an even greater reason to do so.
All right, I'll get it.
Any other comments on this? So we'll go to the next article. This is an interesting one. People with COVID and other infectious diseases, respiratory infection, no longer have to isolate for 5 days. This is an interesting article because it says that 24 hours after you start improving and have no fever, then you can go back to work. That's the CDC's recommendation, which is different from what it had 2 years ago, where it felt you should isolate for 5 days. Now they're saying you can go back to work when your fever is gone and when you are feeling better. What are your thoughts? Any concerns about that? It implies
I don't have to go to work.
it implies that you're not as infective any longer once 24 hours after your symptoms have improved and your fever is gone. That's the implication.
My comment is that
What about
my comment, Dr. Callender, is that COVID has not disappeared. It's still there. I just talked to my friend in San Francisco, who's also a musician. He and his spouse got COVID for the second time
Really?
last week. So,
Wow.
and at the gigs I go to, people don't wear masks anymore.
That's right.
Grocery store, nobody's wearing a mask. Maybe one person.
Yeah, right. Yeah. Church the same way. Well, maybe about 10% in church, because still see some people, but in the big audiences, like you mentioned, I rarely see people with masks. In church, I do see about 10% of them with masks. So.
I really I really am skeptical about that because generally if you have a cough, you're gonna spew some elements in the air. Even so, you cover it, with your elbow or your inner arm or something. But I am real skeptical about people who have had. Not always do they have a fever,
Keep
and
your
and
skepticism.
Well,
Maintain your skepticism.
yeah, thank you. Thank you. I will.
Yeah, you got the right idea. Better to be safe than sorry.
COVID, COVID, when COVID first started in 2020 and we all had to be isolated and kept at home and all, it helped to solidify my belief in just being at home, loving my home, enjoying my home. I know being around people, you need that interaction, but it brought Zoom to us so we can at least see each other. But the telephone is still there. You can always talk to people. But I have grown much more comfortable being home and out of crowds. I order my groceries now. I do church basically in-house. But I do go to press service on Zoom and this type of thing. So I'm grateful for Zoom. I talk to my friends. Main events, Christmas, Thanksgiving, birthdays, things like that. We do get together. But I have learned to be content at home and not go out so much anymore. I'm loving my life the way it is, and I hope it's going to help me live a little longer.
Any other sharing? Carol.
Yes, I was just wondering, the reason probably people are not wearing the mask and et cetera, what about the death rate? Before, it was a death rate that was perpetually in front of us, talking about how many have died that day or that year or that week. Now we no longer hear of people dying from it. So it was just like, as any illness, you know, even the flu vaccine, people say, they knew that some people were dying, but it wasn't enough for them to hit the newspapers. So what about the death rate as far as COVID?
Well, the death rate from COVID has dropped as well as from the flu because the number one respiratory or infection is now tuberculosis. So it's dropped down. That doesn't mean that people aren't dying, but they aren't dying anywhere near as commonly as they were. So that tuberculosis has replaced COVID and flu as the commonest respiratory cause of death. Any other comments or sharing? No. This is an alarming article that points out that even in pasteurized milk, they found traces of bird flu. And of course, there's first reported death of a person in the United States from bird flu virus, which is not surprising since xenozoonosis is actually more common than we think. And the fact that they found particles in the milk suggests that we're going to have more deaths from bird flu in the United States, but time will tell. But this may be an early warning sign that pasteurization is not able to overcome. Although you only had one death, but probably where there's one death, there's others to follow. So be careful about your milk. Dr. Press?
My question has to do with the previous article. So I'll wait until everybody's had
Well,
their
go ahead. Give us your comment.
I was shocked by the fact that you said tuberculosis. And where we obviously has missed the step as it relates to tuberculosis that we know how to treat.
Yeah, I was kind of surprised to see that as well, but it wasn't close. TB was far ahead of COVID and the flu, which is a dramatic change from previously. Uh, and yeah, for the most part, we know how to treat tuberculosis, but it's reared its ugly head again.
And Dr. Callender, tuberculosis is bacterial, right?
Mm-hmm.
It's a mycobacterial infection,
Okay.
which is a little different, but yeah, it's a mycobacterial infection, which devastating usually occurs in the lungs, but can occur in spine as well.
And what's the treatment that's given for
Well,
tuberculosis?
isoniazid and then they have other anti-TB drugs that can be effective. Most of the TB strains are treatable by common anti-TB medication, but they require special medication. But isoniazid is the most common drug that is used for treatment of tuberculosis.
Thank you.
Any other comments about that? I know I was surprised to see TB as well becoming number one. Of course, some of that is because in response to Carol's comment, the death rate from COVID has dropped tremendously, and the death rate from flu continues to be constantly high, but TB is even higher.
And I guess with TB, similarly with COVID, because of its impact, we put good public health in place.
Yeah, of course.
Now,
Mm-hmm.
now that it, just like COVID has left the media and the spotlight, we are less intentional about our prevention. And the same thing with tuberculosis. In terms of our prevention efforts, our outreach efforts, public health efforts,
Yeah. Yes.
repeated history.
Yeah. Well, I think that one of the differences with TB was that isolation was not optional; it was mandatory, and masks and all the other things were not optional either; they were mandatory. Because the comment that Jochebed made relative to spreading uh, TB are ever present. So there was no option of not wearing masks. You had to wear masks. Okay, any other comments about, oh, John Buchanan.
Yeah, we have John Buchanan, and then I'll go after him.
My comment was on this next article about the bird flu, and I just got an article yesterday, which I did not include yet. That'll be next week, where we've had our first death from bird flu.
Right, and I expect there are going to be more, especially with this article suggesting that the traces of bird flu in pasteurized milk. So it's going to be interesting to see how many more deaths we have from. Of course, one death is small, but where there's one, there are probably others.
My question had to do with pneumonia. Are we in better control of pneumonia?
What was your question?
Do we have a better control of pneumonia?
Yes, we still have a number of deaths from pneumonia, usually in people who are over 65, but and we still have a lot of walking pneumonia. Um, but most of that is in the over 65 population. Most of the pneumonia is susceptible to the antibiotics that we use. Uh, so for now, that is helpful. The concern is that as we continue to abuse antibiotics, that we get resistant strains that are not susceptible to the commonly used antibiotics. Any other comments? If not, we'll go on to the next one. It says there's no reason to stop drinking milk, but it makes you wonder if you can find viral particles in pasteurized milk. It makes you really wonder.
Dr. Callender on I forgot Adam, something about Adam. Well, they always expose different things of why they happen, like diamond rings weren't really that valuable until the 30s, and someone came up with that brilliant idea, give a diamond to get married. But they did the same thing about milk for the industry to economical that they started producing advertisement that parents need to give their children milk 3 times a day. And then they came up with some studies that they shouldn't. But I was in the generation where every meal you had to have milk because they said that was good for you. Then they have articles now that's saying that milk really isn't that essential for growing strong bones and body. You have any comments about that?
Yeah, I think that we as a group have a lot of lactose intolerance. And as a consequence, while milk might have been desirable for the not African American patient, it was a problem for African Americans who were lactose intolerant. So yeah, that was good for white people, but I'm not so sure it was that wonderful for Black people who are lactose intolerant. So if you're Black and you're not lactose intolerant, then it may not be an issue. But so many are lactose intolerant that it wasn't that healthy for. While it's good, Riley, and I think Darryl has spoken about this on a number of occasions. That it has its good points, but for us, there's so many aspects of milk that make you want to, if you're Black, to leave it alone. That's my thought on it, anyway. Darryl, any other thoughts? You've spoken about this many times.
Yeah, I agree with you completely. And a lot of people don't understand lactose intolerance. They think that it's an extreme reaction, but it's really not. If you get a little bit of gas, that's probably indicating some lactose intolerance. You got to consider that cow's milk is designed to grow a 2,000-pound cow. not a 200-pound human being. And so it's got a lot of different enzymes that are not designed for human beings. True, it's got a great advertising campaign, especially for the dairy farmers in Wisconsin. But you even have to consider that in Europe, um, milk they use ultra high temperature processing, different than America, which means that in America the milk isn't pasteurized at a high enough temperature, uh, and so it's not shelf stable. In Europe, they don't refrigerate milk because it's ultra high temperature processing, and it's more effective against killing viruses with with a higher temperature, and so they have less incidence of finding things like bird flu in European milk. European milk is shelf stable; it's not refrigerated. Main difference: why don't we do in the United States? Because refrigerated milk, where you don't use ultra high temperature processing, tastes better, but it's not as safe. A lot of things that we do in the United States is for marketing. A lot of good benefits. Dairy products. There's nothing. It tastes great. Butter, cream, in recipes. It makes things taste smoother, tastier, but it's not good for you.
Any other comments? If not, we'll move on to this article, which suggests that apple cider vinegar is a good product to use weight in this day and age when glucagon products are injections are common. This is a study that suggests that 5, 10, 15 cc's over a period of 12 weeks leads to, as you can see here, 6 changes for the better: body weight, BMI, hip to waist ratio, blood glucose levels, cholesterol levels, and triglyceride levels. It normalizes those things and helps you lose weight, and doesn't have some of the side effects of the uh, glucagon derivatives. But so I don't know anybody who actually has used this. But anyway, this is an article that talks about another way of losing weight. Carol and Darryl.
Oh, Darryl can go first.
Okay. I do apple cider vinegar about 3 times a week, just when I think about it, just because I know that it is a good thing to do for weight management. And an easy way to do it is take a juice glass, fill it with water, and then take a splash of apple cider vinegar. That way, it's just straight by itself. You'll choke to death because it's pretty strong. But a splash, fill up a juice glass with water. It's very potable that way. You can get it down very easily, and it does have good results.
Carol?
I had a friend who didn't know how to take it, and he had to go to the emergency room because the acidity of it in his stomach, I forgot what illness it caused, but it, medically speaking, I'm not quite sure, but the acidity in for his stomach lining and everything sent him to the emergency room. So maybe you understand that better, but I think he was taking it straight or something without diluting it.
Thank you for sharing, both of you, because this is not something that is commonly used. And the glucagon derivatives have taken over the market for the most part.
Yeah, taking it straight is pretty stupid. You do stupid tricks, you win stupid prizes.
Thank you, General.
Well, there is no directions on, because I tried it for a while, but sometimes I don't go through with things sometimes. But I was going to do this apple cider because it's supposed to do so many, help you in so many different ways. But they tell you put a teaspoonful of this and water and juice. I thought we are supposed to stay away from juice, Darryl, but it doesn't tell you. It tells you take it with some type of liquid, but there's no directions really on that vial. And for a while, apple cider vinegar was going off the shelves in the grocery store because everybody was buying it for health improvement.
I just gave you directions. Did you not listen?
Huh?
I just gave you directions. Did you not listen? Or do you want me to say it again?
Well, you used the word juice, and I thought we were supposed to stay away from all juices
No,
because of the high
No,
sugar
I said
content.
a juice glass. You
A
know, a
juice.
juice glass is one of them little short things that gets about 5 or 6 ounces of fluid in the glass. A little short glass.
I
Fill
know.
it
I
with
thought
water.
those were for shots, and we're supposed to stay
No,
away
not a
from
shot glass.
alcohol.
A shot is 2 ounces.
Oh,
Okay. Everybody know what a juice glass is? 5 or 6 ounces, little short
yeah,
thing.
yeah, I do.
All right. Fill it with water, then a splash of apple cider vinegar.
and you can't add sugar to it because it surely is bitter.
It's diluted enough with just a splash where you don't need to add sugar, and adding sugar is bad anyway.
Okay. So what's a splash?
Ask Grandmama. She never used a teaspoon or any measuring thing. She knew what a splash was. Your taste buds will know what a splash was if you say, that's good. That's a splash.
I
So
bet Dr. Callender doesn't know what a splash is.
I would think that's about 3 to 5 cc's. That's what it's that's to me. That's what it is.
Okay, I don't know what a CC is.
About a
Okay, a table,
teaspoon. About a teaspoon.
a teaspoon. Yes, thank
A
you.
teaspoon. See,
Teaspoon.
that's my language.
Carol said,
Yeah,
talk to me like I'm a
teaspoons.
6-year-old. Carol.
Huh?
Carol said, talk to me like I'm a 6-year-old.
Right.
Teaspoonful.
Yeah,
Okay, all right. Yeah.
A
A
teaspoon.
teaspoon, 3 to 5 cc's.
Good, good, good. Very good. I love this conversation. The ability to give and take, brother and sister. Okay. Now, this is an interesting article because it says that the FDA is investigating all of these glucagon derivatives because there's so many side effects that, and remember, all of these are given by injection. And there are a number of side effects, although the benefits are extraordinary. But there are a number of side effects, and as a consequence, the FDA feels it's important to be sure that the safety of the product is good. I think a lot of this happened because of the fact that the glucagon derivatives were given as compounds and not without directions. A lot of people were taking incorrect doses of the glucagon derivatives, and as a consequence, they had many more side effects. I think if we get away from that and have patients who actually take the correct doses of the glucagon derivatives, you have less side effects. By the way, I noticed we have 21 people today, which is more than we've ever had today. So we got some new people who joined us. Welcome. Any comment about this FDA investigation of the glucagon derivatives that have been a little short of miraculous in terms of the way it affects kidney, liver, and other organ systems? Any comments? Lucy, no comment?
No comment.
Okay, all right. You wait and see what FDA finds, and then we'll see. Okay, I don't know why they're surprised that they want to investigate the safety. It has so many side effects because people are overdosing. they need to look at it and help people to get away from taking the drug improperly. The proper doses are as associated. John Buchanan.
So, is this an injection?
Yes.
Okay, so in order to use it, you have to inject it usually
Yes.
in your stomach area.
Inject it wherever you want it because wherever it's subcutaneous, most people use the stomach area though, because that's the big area. And the butt is okay, but the stomach is good too.
So some people who are way overweight who are trying to lose weight quickly would take more than is prescribed. Is that the point?
No. What happened is that the drug was so popular that you could not get it, and so as a consequence, they were giving out compounds of glucagon derivatives, but they did not tell people how to administer it. And some people gave themselves the wrong doses. And these doses were associated with more symptoms. And so, as a consequence of that, there was concerns about suicidal ideation, diarrhea, and other GI complications. And so the FDA needed to investigate it to find out what was the real issue. Now that the amount of glucagon derivatives has gotten to the point where you don't need to use the compounds that don't give you the right dosage, this is less of a problem. But to me, it's fair game. It should be looked at and investigated and evaluated. So we prevent people from hurting themselves by taking too much of the medication. As a matter of fact, on the commercials, you see them giving injections in the stomach in some of those commercials. Any other comments about that? Okay. Now, this is an article that isn't surprising. 6 in 10 Americans have low inflammatory diet, and they talk about black tea and ginger garlic being great, but how many people use that? And they talk about the French fries, soda, sweetened beverages, and processed meat as being the source of the pro-inflammatory diets. Remember our presentation before by one of the physicians who gave an incredible lecture on nutrition and how our diets was killing us. Well, this is an article that just says it in a nicer way, but says the same thing. And we know now that fruits and vegetables and getting away from meat and processed foods is the key. This says it here, although these two sentences really are the essence. Fruits and vegetables and garlic, ginger, and turmeric, and green and black tea as fruits and vegetables. This is some of the stuff that Darryl has been talking about forever. John Buchanan.
What, Dr. Callender, what does inflammatory mean?
It means that you are causing the body to be inflamed. That's one way of putting it. So that you're having, for example, the best way to have health is to have antioxidants, which are against inflammation. Inflammation causes the body to be disturbed, and it renders ill health. whereas antioxidants or vegetables and fruits and legumes are anti-inflammatory. Whereas, so as anti-inflammatory is good, pro-inflammatory is bad, to make it simple. Any other comments or questions? Darryl, any comments you want to make?
Let's see, some of the most inflammatory foods are going to be red meat, sugar, alcohol.
Look at the numbers high for Black Americans and people with lower education and income. Yeah. That's one of the things that is unfortunate. It costs money to have anti-inflammatory diets. So go to McDonald's and get all of the pro-inflammatory stuff you want. It's cheaper. So. Any more comment about this? Because this is critical, very critical for us to realize that our diets, for the most part, are pro-inflammatory when we need to have anti-inflammatory diets, which are rich in fruits and vegetables and avoiding meat. Any additional commentary or comment about this?
I think someone can get rich by inventing, it's another drug, something to prevent us from liking sweet things, liking fried things, destroy your taste buds. That's, to me, I mean, I might be addictive, but part of joy is eating something that tastes good to your palate, and you've been trained. So you got to untrain yourself to like, I love French fries, but I know they're not good for you. I love sweet stuff. So if someone could just invent something besides what my brother told me, you know, you train yourself and discipline yourself not to like it. To me, that's taking the joys of your childhood away when you like a piece of candy. You can get a kid to do anything, even in high school, for a piece of candy, and that's sweet. So if we can
Actually,
untrain ourselves, I don't
they
know if
did invent
anybody else
something.
has joy of eating, but that's taking one of the joys of, you can't drink, can't eat stuff you like. Wow. Give me a pill so I just go to the table and just eat bland food.
No, they
Thank you,
invented
Carol.
Lent.
You expressed it
Lent.
well. You
Yeah,
expressed it well.
Lent is Lent. During the Lenten season, you're in the habit, you create the habit of giving up stuff. So when you give up, it's not just Lent, it's good for you to give up stuff. It only takes 3 weeks to change your taste bud. You don't eat sweets at all for 3 weeks. Sugar won't taste good anymore. If you got that craving for red meat, you don't eat it for 3 weeks. It won't taste good anymore. You can redevelop the craving just by going back to bad habits. But the good habit that we don't have is called Lent or forbearance, the act and the habit of giving up stuff.
Carol, you're up again. Yes, Carol.
Yeah, okay. I'm sorry, you probably have to cut this out. But I'm a Baptist, and for the longest, Baptists didn't believe in Lent. Somebody invented that. And I surely did enjoy myself because I didn't have to give up anything during this season. But anyway, okay, I will desist. Nobody else has this problem but me.
Yeah, well, that's not true. Everybody has a problem. What you expressed is common.
Very cool.
Very common. So you're not alone, my dear.
And what also helps is weighing yourself every morning. You get up in the morning, you look forward to weighing yourself to see how you're managing your weight.
Doctor told me one time that everything that you like to eat is probably not good for you.
You know, I think that Darryl mentioned something that is relatively invaluable. That is to weigh yourself daily to keep, you know, particularly patients who have weight or heart problems. One of the ways to know whether you're moving in the right direction is to weigh yourself daily, and you can tell whether you are gaining weight or losing weight, and you should be staying the same or losing. And when you're gaining weight, that's a sign that the fluid's accumulating and you need to do something about it.
And it doesn't take, if I'm up, like say, it's a digital scale. If it says I'm up a half pound from the day before, then the way I feel about the current day is to take it easy so I can get that reward the next day to say that you lost that half pound and you're back to your target.
Okay.
Again, I will say I really do enjoy that ice cream cone for that moment, even though I know it may put a pound on me the next day. That pure pleasure of that moment, I enjoy the ice cream cone. Okay, enough said.
Yes, enough said. Okay, we're moving on. This is unusual. In 14 years, they haven't issued a urinary tract infection guidance. And the reason they're doing this is because we recognize that in the next 10 years, if we don't change our antibiotic use and abuse, we will have infections that will kill us because we don't have the antibiotics to treat them. And so as a consequence, they're trying to come up with new ways to decrease our giving patients antibiotics for things that are unnecessary. And so, for example, there's osteomyelitis and endocarditis. Those are infections that you need to have antibiotics to treat them. But some of these other things don't require those kind of antibiotics. And if we abuse the antibiotics, then we will have bacteria that are resistant to the antibiotics, and then people will more likely die from infection. But these are the 6 recommendations they came up with that I thought are very good. There is a role for cranberry juice or supplements, and this has been demonstrated clearly that cranberry juice reduces the risk of urinary tract infection. And it also says in topical estrogen can be used for postmenopausal women to reduce urinary tract infections. And then this drug, methenamine hippurate, has been demonstrated to prevent recurrent urinary tract infections. And then, of course, what is also clear is that if you don't have any symptoms, that using antibiotics to treat urinary tract infection is unnecessary. And there are oral agents that nitrofurantoin and gantrostin and other drugs like those are kind of drugs that don't give you antimicrobial resistance, which can be used. And then they recommend against giving antibiotics for procedures that don't require them. So that's the sharing of it that I think are appropriate. The others really have to do with how the doctor should treat different infections. Any comments or questions about this? Because urinary tract infections are something that occur, but sometimes are treated inappropriately. Next graphic.
My comment would be that some antibiotic resistance is caused from eating conventional meats. Conventional meats, whether it's beef, chicken, or pork, they're all injected with antibiotics, which gives you some antibiotic resistance. If you eat organic meats, it's not injected with antibiotics, but it's more expensive. And if you stop eating meat at all, then your grocery bill drops like a rock.
Miriam Jordan, you had a comment or not? Oh, okay.
Dr. Callender, is this for doctors or patients? Because you go to a doctor for urinary, and how many doctors will say, drink some cranberry juice and see me later?
Well, actually, it's preventive. The cranberry juice is preventative. If you
Okay.
get the urinary tract infection and you have symptoms, then you need to take antibiotics. But if you take cranberry juice, you might prevent yourself from getting the urinary tract infection. And you're right, the doctor is more likely to treat the infection than to educate you as to how to prevent it. And that's the problem with westernized medicine, is that we emphasize treatment rather than prevention. Next article, please. And we've talked about this before. Vitamin D supplements, and this article is confusing, but the bottom line is that vitamin D supplements may be good when they're given to people who have vitamin D deficiencies. But vitamin D administration, when you don't have vitamin D deficiency, is not necessary. And that's what, in essence, the article says, is that, yes, if you have vitamin D deficient, you need to take vitamin D. But if you're not vitamin D deficient, most of the studies have identified that you do not need to take vitamin D supplements. The long and short of this long article is that the vitamin D industry is an $800 million a year industry. So advertisements suggest that taking vitamin D is good for you, but it's only good if you are vitamin D deficient. There have been many studies that have looked at kidney disease and other things, and you can find studies that will support whatever position you may want to take. But in general, the bottom line is that if you're not vitamin D deficient, the need for vitamin D supplementation is usually unnecessary. However, many people who are of color often turn out to be vitamin D deficient. And so that's why vitamin D supplementation becomes important, because we find that in people with kidney disease, they're often vitamin D deficient. Janice.
Yes, I've been told that I am vitamin D deficient. During COVID, especially, the doctor was tracking all kinds of levels. And I was told the average range for vitamin D is 30 to 100. I stayed at 20. Might get it up a little bit, 25, 23, stayed at 20. And so since then, he had me on Citracal D with a vitamin D supplement. I finally made it to 30. Not great, but he said, for me, it's good. So I've been doing this for the past 5-6 years. Any problems in me being on this regimen as long as I have been?
No, because you have what is required. You are vitamin D deficient. Mm-hmm. And for people, and many people of color have vitamin D deficiencies. Yeah. So unless you get a vitamin D level, you wouldn't know it. Mm-hmm. But if you're vitamin D deficient, you need to be on vitamin D.
Okay.
If you're not, the supplements are okay, but they're not necessary. Mm-hmm. John Buchanan.
Yes, I remember growing up, all the milk used to have vitamin D.
Absolutely.
So what happened?
They still do, and vitamin D is still in eggs and all other kinds of things, because there's so much vitamin D deficiency. And as we look at patients with kidney disease and many other diseases, we find that people who are older sometimes are vitamin D deficient. But unless you get a vitamin D level, you probably wouldn't know whether or not you're vitamin D deficient. And so for those people, vitamin D supplementation is important.
What would your symptoms of deficiency be?
You might have none, but you also might have cardiovascular disease, or you might have kidney disease, or you have other things, so that you will likely have no symptoms. So you would need to have a vitamin D level. And some doctors empirically, if you're a person of color or you're over 60, they'll put you on supplemental vitamin D because vitamin D deficiency is so common. John Tatum?
My question has to do with DEXA scan. Is that a way to tell whether you're vitamin D deficient?
You're talking about the scan?
Yeah, for bone loss. Yeah.
Yeah, well, I think that that there are many reasons why you might have bone density loss. So vitamin D is one of them, but there are other reasons. And so I think when you're older, that getting a bone density is a good idea, because if you do have osteopenia or osteoporosis, then vitamin D supplementation would be good, especially if you are vitamin D deficient. Any other questions or comments about that? Now, this is another article that says that higher vitamin D levels are linked to improved mental health. And this is a completely different stance that suggests that having enough vitamin D levels is important for the brain. And this is relatively new information that suggests that the higher your vitamin D level, the more likely you are to be good mental health. So has not stood the test of time, and so whether or not this will be confirmed by additional studies remains to be seen. But this is a study that bears watching. Any comments or questions about this interesting article about vitamin D levels being associated with better mental health? Next slide, next article, please. Here we go again. You know, it reminds me of John Robinson, our psychologist, who as it died a couple of years ago, because every year there was a new blood pressure guideline, and that's still the case every year. Now they've made it so that they talk about hypertension, elevated blood pressure, and normal blood pressure. And they want the ideal blood pressure to be between 120 over 80. You see, again, less than 120 over 70, elevated 120 to 139, and hypertension greater or equal to 140 over 90. But the goal is to get you to 120 over 70. And this is associated with less kidney disease, less hypercholesterolemia, and other things. So yes, we're trending towards the lower the blood pressure, the healthier you are. Now, of course, if you don't take your blood pressure and you don't know, then that's a problem. But one of the reasons this is a concern is because we've looked at the mortality rates from cardiovascular disease. They haven't changed. And a lot of this is related because, in fact, the people have uncontrolled hypertension. And if the blood pressure is controlled, the cardiovascular mortality rate should go down. This is something we have to work towards. when we do our studies, most of the patients who have hypertension are people who are being treated for hypertension but are not controlled. And there's no value of being on high blood pressure medicine if your blood pressure is not controlled. So, so this is food for thought. Do you have a sphygma manometer at home? Are you able to measure your blood pressures? And if you are measuring your blood pressures at home, are they in the vicinity of 120/70? And if not, they should be. And if your blood pressure is not moving in that direction, then you're not controlled, and you're not controlled, the complications from cardiovascular disease remain a concern. Any comments or questions about this? You remember we had, yeah, go ahead.
I'm having a problem of keeping the range in mind. And I've Googled it and everything because, different reports say different things. What is the very highest? What's the very lowest before you get out of sorts and know to go to the emergency room and all of that. So where can I go to find what that range is? Because it keeps changing.
Range is easy. If you're more than 140/90, you've got high blood pressure. If you're more than 160/90, then you're ranging to the point where you need to be on medication. And if you're better than 180 over, then you need to go to the hospital to get your blood pressure regulated. And in order to do this, you need to have a blood pressure monitor that you take your blood pressure maybe once or twice a day, so you know that you're in the range of normal, which is less than 140/90, which is, so 140/90 is hypertension even by this study. Okay. But the ideal, though, should be 120/70.
What's too low?
What's too low is that which gives you symptoms, because we have many patients who have blood pressures of 90 and 100 and who are asymptomatic. But if your blood pressure is 90/60 and you're asymptomatic, that may be your normal blood pressure. But any blood pressure that's lower than that, that is associated with you getting dizzy, is too low.
So what do you do when it's too low?
If it's too low, then you need to go to the emergency room. And when it's low, that means that you're having symptoms. You're getting dizzy. And yes, you need to go to the emergency room and let them take care of you, because blood pressure that is too low, that is associated with symptoms, is dangerous, because then the circulation to your organs, vital organs, is compromised. And so when people who are on blood pressure medicine, they stand up quickly sometimes, the pressure drops and they get dizzy. And that means that you're on too much medicine. But there are many people walking around with 90/60 who have no symptoms, and they're normal.
Dr. Callender, what is this renal denervation?
Oh, that's a situation that they recommend, in which when all others measures have failed, that they can block the nerves to the kidney. But that's when all of the medications have been resistant to treatment. So renal denervation under those circumstances, which is rarely necessary.
And how do they do it? Is it a medication again?
No, that's surgery.
Surgery. Oh.
Yeah. Yeah.
Alrighty.
Any other questions? If not, this is a very important topic. It's killing most of the cardiovascular deaths are related to uncontrolled hypertension. Next article. This is interesting because an Oregon may change the name of physician assistants to physician associate. Nowadays, many of you are being seen by physician assistants rather than physicians because of the shortage of doctors. So does the name change mean anything different? It's only in Oregon they changed it there. But physician assistants really are very common these days. And in most doctors' office, they have a physician assistant who will take your vital signs and even, they can even prescribe medications nowadays. So this is a way of overcoming the doctor shortage by using physician assistants or associates, as they call them in Oregon.
Another name that they're known by is nurse practitioner.
Actually, yeah, nurse practitioner is different because they actually have a different specialty in which nurse practitioners actually function almost similarly, but there's a different. Those are nurse practitioners. They practice as physicians, and the equivalency of the practice is as you say, but they would argue that they are a different brand. Nurse practitioners and physician assistants are different entities. Nurse practitioners, for example, are licensed to even give intravenous medications and other things, so that that's a step beyond, closer to the doctor than as a physician assistant for the most part.
Okay, doctor, I know how I feel about it when I get a physician assistant. I feel like, okay, we're the lowest on the totem pole because we can't see the real doctor, or we just have someone that's there. Or sometimes they give all new patients physician assistants until they figure you are important enough to be seen by a real doctor. I know that's a feeling, but how do physicians feel about it? Oh, I'll just give this patient to my assistant because, etc. Is there any difference of how a patient should feel about it?
That's a good question. I have not used physician assistants, so I'm not the one to.
So if you go into a doctor's office and you're seen by the assistant, how do you feel?
Gee, that's never happened.
Oh,
Never happened. I kind of would feel cheated, but that's the way things are going these days. And
just by the mere fact that you got a doctor behind your name, they wouldn't do you that way. But I don't. And so I'll go in there and they'll give me their little assistant. And I'm going, oh man, they could be just as competent as the physician, maybe, but they haven't had that education that I think that I need, maybe. So how do you, and sometimes I've said, I would like to see the doctor, and they had, well, you can see the doctor in about 4-6 months because they're so.
well,
I wonder if anybody else has experienced that on this panel, or is it just us?
let's hear some feedback. Any comment, Janice?
I've never.
Uh,
Go ahead, Janice.
I in my primary care doctor's office, I was ill a few years ago, didn't know what was going on, had to go into the doctor's office without an appointment. And my regular doctor wasn't there, but the physician assistant was. He was great. I had no complaints at all. Um, he's still there, and I believe still as a physician assistant, but it wasn't like the next time I went back, I saw that same physician assistant. I saw my primary care doctor, and it worked out fine. Recently, a couple of weeks ago, I had I was quite ill. Turned out I had food poisoning and I had to see a gastroenterologist, but I've been at that office before. I had a regular doctor. This particular day, the gastroenterologist wasn't there. He did speak to me and he said, if it continues tomorrow, come to the office, but you might have to see the physician assistant. I was more pleased with that physician assistant than the doctor, and the doctor was great. So my two experiences with a physician assistant was great, but there were not experiences where it was ongoing. The next time you came back, you saw that assistant. The next time, the assistant. I always saw my doctor, my regular doctor, as the follow-up appointment. So I don't know how it works with anybody else, but because you see that physician assistant once, it doesn't mean you're assigned to that assistant.
Any other feedback from other patients?
I've never had a physician's assistant at my primary care doctor's office, but over the years, a couple of times I went to urgent care and was treated by a PA with very good experience.
Any other feedback?
I have quite a bit of feedback on the issue, and it might be biased. When you just talk about the comparison in training, and the fact that it was supposed to be physician assistant and not physician replacement. And the same thing with nurse practitioners. And in many cases, as it tends to happen quite a bit, you get what you pay for. And I know some colleagues, people that I know who have had phenomenal practices, can't afford to practice solo without physician's assistance because of what they're getting back from insurance companies. So it is societal what we're dealing with. It is also economic. And in many cases, the element of deception is there. There have been a couple of nurse practitioners, because they have a doctorate, have been referred to me as doctor, and they're nurse practitioners. Not to say they do not have their place, but in terms of mode of training, years of experience, there's a significant difference between a physician assistants and a nurse practitioner and a physician.
Any other feedback?
Okay, it's just like if you go into a law office, either you're going to see the lawyer or the whatever you call the lawyer that it doesn't have quite. You want the lawyer. So why are we, medical? I guess because of the money, but it does something to the patient. You know, if a nurse can do just as much as a doctor and knows just as much, so why are you spending all that money for training?
Mm-hmm. Well, the nurse practitioner is more than just a nurse. The nurse practitioner is somebody who's trained to do things that the doctors do. But it's not a doctor themselves, but they are elevated along the lines closer to the doctor. But economics plays a major role in it because they really are so-called doctor substitutes. Any other feedback you want to give us on this interesting?
Doctor substitutes?
Well,
I
let's take it.
Smokey Robinson sang a song about a substitute.
Yeah, well, in point of fact, it was created so that the physician assistant could take the place of the doctor in his absence. That's how it evolved, primarily because of the shortage of doctors, so that you would have somebody who could play the role of the doctor who wasn't as fully trained as the doctor. So, and the term was initially physician assistant, and then it has evolved over time. You have nurse practitioners, so on and so on. And yes, in my view, they are the physician substitute. Yeah. Any other comment, feedback? There are many different opinions on the subject, so it's good to hear as many of you as are willing to speak about it and how you view it when you see your physician assistant. Okay, hearing no comment, we'll move on to the next article. This is an article that we included because what are the gifts that patients give doctors? You know, as a physician, I've had sweet potato pies, apple pies, and actually, you know, I got a gift that I think I got this Christmas, which was surprising to me, from actually one of those switchboard operators. Gave me a personalized sweater with my year of graduation from medical school and my name on it. That was very amazing to me to see that somebody would really research me, find out when I graduated from medical school, and then give me a sweater with me on it. So I think those are the kinds of things we talk about. In this article, they talk about patients giving them gifts that they spent hours on putting together, knitting things and giving a world-class knife. And they're things, none of them are actually monetary, but they are actually things that the patients themselves valued and gave of their own personage, and they made a difference. As a matter of fact, none of the gifts that they talk about have to do with money. They have to do with things that were made by patients themselves that typified the appreciation of the years of service that the doctor had given to them. And in this article, you can go through it, and it's very touching to see how the patients gave of themselves gifts that the doctor would never forget. Any comments? Any of you have given your doctor's presents and because in general, it is discouraged to give doctors presents. Any comments?
Just one. What do doctors want?
Thank you.
Mm-hmm.
Family said they're very low.
Appreciation. You say thank you. thank you for what you've done. And that the greatest present you can give me, and I've had this many times, is I've walked around the hospital and ran into children of patients I transplanted, wives of patients I transplanted, children of patients I transplanted, and patients themselves who said thank you. They really appreciated the service. The best gift you can give me is to say thank you. Elizabeth?
Yes. I gave one of my doctors a bouquet of flowers um, because she did she did surgery on me, and that was another situation where she had to pull another doctor in, and they teamed up and did the surgery. They said because we know Elizabeth, if we don't do this, she will never come back again. But so I gave them flowers because I really was appreciative of what they done and how they took care of me.
Any other comments?
Dr. Perez, what would you like?
You know, when once I got, the first thing I thought about was when a patient came bringing me a negative pregnancy test. High school graduation, keys to their apartment. Like Dr. Callender said, thank you. It doesn't, people, the profession allows you into people's lives in ways that are such a gift. Being there is a gift.
Any other comment? It's interesting because, what Dr. Perez said is so true, that doctors have the authority to examine patients, and any other profession, that's assault, physical assault. But doctors have the opportunity to touch you and feel you and examine you in a way that's special. And so when you get feedback from patients that are appreciative of what you've done, that means more than anything else.
I would agree with Dr. Callender. I am a nurse, and I know for me, accolades. The one word that I always strove to receive was thank you. That thank you seemed to go so deeper and so much more deeper, and it was anointing for me to receive the word thank you, and if a smile came along with it, that was just glory.
Thank you very much for sharing. Anyone else?
One of the things I hate about today's age is every time you do anything, you get a survey. And I hate those surveys. I usually delete them without even thinking twice about it. But, what they ask you out of survey could go along with that thank you if you've got a good doctor. So, you got to go in for your physical. If something happens, you're going to see that doctor maybe once or twice a year. And if he's giving you good treatment, if he cares, if he listens to you, more than just thank you, say thank you. You're a really good doctor. You listen to me. I feel like you really care about what's going on with me, and I really appreciate that because you get a doctor like that once in a lifetime. But let the doctor know that. And if you do have a good doctor, as much as you hate all these surveys you get for everything, give them a good review. because it's kind of like the doctor's permanent record. It goes on their permanent record for everybody to see.
So true. Any other feedback?
Yeah, one more. Like have your doctor get to know you as a person, so that you actually have a relationship, that you can consider them a friend of yours, not that you hang out together, but that they really know you, because that'll get you better treatment and better care. They're going to take better care of their friends. So, like from my doctor, my primary care doctor. He comes out to see my shows because he knows I'm a musician and a singer. So we don't hang out together, but we have a better relationship than otherwise, just because he knows that I'm a real person, and he checks out my shows.
Any more feedback before we go to the next article? Okay.
I think one more thing besides the thank you, a personal testimony on how they really affected you. We say thank you so easily, but if you just get that personal relationship, thank you. And if I see a student and they say thank you, and this is what I'm doing now, and how you affected my life in that particular instance, that does give me joy, because teachers, they give you perfume that you don't even like. And sometimes they give you food and you're not quite sure what kitchen that came out of. I don't know about anybody else, but now that we have this time of age, but this thank you with a little personal touch to it. This is how you affected our life, or this is because of you, and this is what I'm able to do now. So thank you so much. That article brought out how we should treat everyone when we say thank you. Give them that personal touch of what they did for you. And that's so much more than all these other accolades that people bestowed upon you. Because candy is not good for you, flowers are dead, and etc. Money, that's nice, but it soon goes away. Sometimes I got awards. I say, well, where's the money? But but the thank you with something, a personal testimony.
Yeah, but I'd like to say thank you to the best doctor I ever had who never treated me. Thank you, Dr. Clive Callender.
Thank you.
I want to thank Dr.
Yes.
for hosting.
We can all join in that one.
Yeah, for hosting this session.
Thank you very much. And
It's about 25, 50 years.
This is the last article. So today we've had more than we've ever had. Maybe there's some new people that we might meet that we haven't seen before. Deborah, Miriam Jordan. I don't think we've.
No, this is my first.